Please be advised that the views and opinions of the host and guests do not reflect those of the station, the management, and its network. Face the nation. A pleasant day. This is Freddy Abando. Welcome to our program, Face the Nation. And today we're privileged to have with us Secretary Teddy Herbosa, the Secretary of the Department of Health, to share with us and our people his plans for the health of our people as a result of his appointment. What are the challenges that really face him as Secretary of Health? A pleasant day to you, sir, and congratulations. And how do you see the challenge of, managing the health of a country, knowing that we are more than 100 million Filipinos that need your care to ensure they stay healthy?
Well, first of all, thank you very much, Freddie, for getting me back on Face the Nation as now the Health Secretary of the Republic of the Philippines. We talked a lot during the time of COVID, and I think this is the number one thing that the President requested me when he appointed me. He said, let's get the country out of COVID-19 because it has affected our economy greatly. And true enough, I think this president will be the president that will take us out of the COVID-19 pandemic. So that's our first struggle. We ended up with very strict economic measures, the community quarantines, but it affected many of our poor and underprivileged because of that. So very important to understand that that's the directives of the president. The second is that we're trying to also address the increasing cases of tuberculosis and HIV in the country. So these are very clear directives from the president. And I've gone around in my first month as Secretary of Health and have seen a feel of what the problems are in our TB control program, in our TB DOTS, or directly observed therapy centers, and the logistics and supply chain management of the medicines needed to treat tuberculosis. Also the active case finding for tuberculosis. And then for HIV, we have one of the highest increases in transmission for HIV. And that's really where I think majority of the problem is that we have very young teenagers testing positive for HIV, although our percentage or prevalence of people living with HIV are still very low. But with all these directives, the specialty center, when the president will inaugurate on July 17th, not inaugurate, groundbreak the first multi-specialty center called the Clark Multi-Specialty Center near the airport in Clark, and that's going to be on July 17th, where he himself will be being head of the ceremony for that groundbreaking for that multi-specialty center. The first building that will rise will be a 100-bed general hospital, and this will be followed by a children's hospital, a heart center, and a cancer center, all in the next few years. And this will be the rollout for all the multi-specialty hospitals in the different regions. And then, of course, the last is really our primary care. We launched this the other week with the PhilHealth, with the sandbox on the Consulta package. So we have a Consulta package wherein we have a primary care provider network. So this is a network of health centers for one province. We chose 5 provinces to actually implement this with initial funding by PhilHealth of 500 pesos per person that is registered in that health center. So for the first time, we will have an actual facility where Filipinos can go to for any consultation, laboratory test, and free medicines of the common illnesses. So that's the study for primary care. In the end, I actually also have my own agenda. I have my 8-point action agenda that I think should actually be implemented by our agency. And I started with the number one, bawat Pilipino ramdam ang kalusugan. So this is really the time wherein this president also will implement the Universal Health Care Act. It's a law we passed in 2019, February of 2019. But because of COVID, the IRR, which was written in October 2019, was never implemented because we placed all our funds and money to fight COVID-19. So this president, President Marcos, will actually now implement universal health care. And the way I simplify that is bawat Pilipino ramdam ang kalusugan. So I want every Filipino to feel the touch of the government, no, in terms of services. The second one in my 8-point agenda is ligtas, de kalidad, at mapagkalingang serbisyo. So very important, we need to understand healthcare is not about buildings, it's not about buying equipment. In the end, healthcare is a service. It's a service by healthcare professionals, doctors, nurses, midwives, medtech, barangay health workers. So if we're able to give mapagkalinga or empathy with the service, then the people will also benefit from the healthcare we deliver. Number 3, this is in line with the government, teknolohiya para sa mabilis na serbisyo. I'm really going to use digital health technology and align with the Department of Information and Communications Technology. They've set up an eGov platform. I think we saw in COVID-19 how telemedicine and electronic medical records and digital health tools helped us fight a virus. So I think that's the same tools we will use to be able to get the Philippines into a healthier mode. No? That number 4 is for the community, handa sa krisis. Very important to be disaster prepared. And Freddy, today is Disaster Preparedness Month. July is our Disaster Resilience and Preparedness Month. So it's very important time to understand that the Philippines is a disaster-prone country. We have volcanoes, active volcanoes, and one is actually grumbling there in Albay. Then we have earthquakes, we have typhoons, and we have so many man-made disasters. We had an oil spill. So we need to be ready and we have to be prepared for such crisis to hit our people. Number 5, pag-iwas sa sakit. So disease prevention, getting people well. To me, that's the most important part of what a Department of Health should be doing. Disease prevention and control. So our top killers now are what we call the non-communicable diseases, lifestyle diseases. Because of economic growth, our people have become obese. Our people have become diabetic. Our people has been suffering from heart disease and stroke. So these are what we call lifestyle diseases. I want exercise, diet to flow into the cities and urban centers where we can actually have better lifestyles. Our children are now not playing patintero and Lukson Tinik. They play computer games, which are not physical. And they end up by 25 or 30, they're already obese, hypertensive, and diabetic. So we need to change that as well. Number 6, very important to our youth today, ginhawa ng isip at damdamin. Mental health and wellness. So important to our youth today, the topic of emotional resilience and mental health issues. Our youth today go to professional help on their own without, unlike our era, Freddy, whenever we only say, why will I go to a professional? I'm not mentally ill. But today, our youth understand this, and with issues like stress, depression, the very competitive, hard life in urban areas, pressure in school, they really need professional help. So I think we will address this. We've passed a mental health law. We'll try to actually implement that as well so that our youth will have support, mental health support and wellness. And then number 7, most important in any health system are the health workers. Karapatan at kapakanan ng ating mga health workers. So very important, we still have arrears to pay our health workers. Those that fought COVID are still awaiting for their health emergency allowance. So I do hope bigay na yun. The budget is there. I see it in the 2023 budget, the support for arrears of 2021 to 2023. And we also put some more that has not been given to the 2024 National Expenditure Plan. Lastly, and this is the biggest lesson we've had, number 8, proteksyon laban sa anumang pandemya. You know, we saw a pandemic after 100 years. Influenza in 1918, COVID-19 in 2019, 2020, 100 years later. But I think the next pandemic is not going to wait 100 years. I think we will have one earlier than that. And we must take the lessons we learned from this pandemic, wherein we had solidarity with private sector, national and local government, and implement good health plans. In fact, I don't even have to wait for the pandemic. My idea, Freddie, is that universal health care can be implemented with the same solidarity we did for against COVID, wherein national, local, and private sector are all in the same goal to implement universal health care. And that goes with my tagline. My tagline is, we want a healthy Pilipinas kung saan bawat buhay ay mahalaga tungo sa bagong Pilipinas.
Well, what about we're running short of nurses because we're leaving. A lot of our nurses are going abroad. So how do we manage the flow of nurses, which are so important to the overall health situation of our people?
Thank you for that question. On my first week, that has been the burning debate, because I proposed a out of the box strategy to actually help those that barely passed, to actually help them pass so we can have a greater pool. Well, the good news is last week the Professional Regulation Commission just certified or passed released the list of newly passed nurses, and we now have 10,720 new certified nurses. In fact, they invited me to give them the oath in August, where they will be oath taking. And our idea now is to present by region all the vacant jobs there. So we will have a job fair during the oath taking of the nurses. So the Department of Health will offer the jobs to all the new nurses that have taken oath. But you're correct, we still have a problem because globally, our foreign countries are taking our nurses right after registration. They will be the ones to train them anymore. So we're at a disadvantage there. And if we don't watch it, we may wake up one day, we are the ones with the deficit of the nurses. So it's very important that we make measures that will prevent that time to happen, wherein we will build these specialty centers, yet we don't have the nurses to actually work in those centers. So it's very important we actually address that right now. And I think that is by giving more scholarships, the government paying for our intelligent kids to be able to take up nursing and other paramedical allied courses so that they can work in the future specialty centers that we will build, and even in primary care centers that we will develop.
Any specific concern which you feel is going to be your personal crusade in terms of your overall quest for better health for all Filipinos?
So for my personal concern is the way the Department of Health and PhilHealth has operated as regulatory agencies, and as PhilHealth as a financing agency. The empathy and malasakit has not been there. They're acting like they want to help the government by standardizing and legalizing, but in the end they're actually creating more restrictions for health facilities to develop by very strict regulatory rules of licensing, by very stiff penalties at the PhilHealth for violations. And we actually changed this mode. I gave instructions. I want a more humanistic Department of Health than a regulatory Department of Health, because we're growing a health system. We need to triple the size of our health system, Freddie. Our current system is just a third of the minimum that WHO requires for a country of 110 million. So we need to triple. That means both private sector and public sector needs to increase their bed capacity, their outpatient capacity, to be able to provide all these services that our people need. And if you're too strict with regulation, the hospitals will actually close. The public hospitals will not be able to provide service. And if PhilHealth is not funding and suspending all of them for 3 months, the ones that suffer for that kind of penalty is the member who is the beneficiary of that income. So I think we need to rethink. So I'm trying to make our whole department rethink. The second one, aside from being a humanistic agency, is number two. I need to. It's 2023, Freddy. If you want to go to the bank, you don't go to the bank. You go to your cell phone and you can withdraw money and actually pay someone digitally. Here at the Department of Health, I have to sign these thick papers for 600 pesos reimbursement. So that's the type of technology that gets us backward. If we continue the same process, we will not be able to actually be efficient. In fact, the Department of Health is already the third highest budgeted agency next to education and public works. But if our systems are backward, we won't be able to absorb all the funds. So I think digitalization of the processes and everything should actually happen. So the fourth one is really, I think I want a better asset management system. We are getting expired drugs. Some of the medicines don't reach the TB centers, and the ARVs have been underestimated because the number of people needing it was estimated from last year. So I need a future thinking type of people, and I need, because of the money we have, I think we should invest in logistics, supply chain management, and asset management as well, so that all the products of the Department of Health can be distributed. We want to also eliminate the red tape. My number one complaints are people trying to register the new drugs and new equipment with our Food and Drug Administration. There are people who want to bring in the most modern drugs and the most modern equipment into the Philippines. But if our FDA continues to be slow and bureaucratic, these people will go away and invest it in other countries in the ASEAN neighbors, to Vietnam, to Indonesia. So we need to fix our red tape as well.
Well, bottom line, it's going to be a challenging times for you between now and, of course, the end of the president's term. But working with this president, how cooperative is he in terms of really giving you the support that you deserve to ensure that your mission will be accomplished without any hitch or problems?
I love that question. I waited long. I thought, in fact, I wasn't going to be the Secretary of Health anymore. I waited for over a year to be appointed. But with the amount of support this president is giving me, when I launched the bivalent, he appeared. He joined. He joined the campaign to distribute the bivalent. And then when I presented our ideas for his SONA speech, he loved everything. In fact, I was being told to shorten, but because the president was asking many questions, that means he was interested in the health of the people. And I think it was a very sincere. And I do hope that when the SONA speech comes out, that he will take many of the accomplishments and the directions of the 8-point agenda into that speech. And I've already instructed this morning my personnel at the Department of Health to already be ready, because if the 8-point agenda is included in the speech, then each of the 8 points must have action plans, definite action plans. So my instructions this morning after flag ceremony was start working on the action items for each of the 8-point agenda I wrote.
Well, a final word from you, Secretary.
Well, my final word is very simple. I've been a public servant for 40 years, working as a government doctor at the Philippine General Hospital. Been asked and tasked to become undersecretary, become special advisor of the National Task Force. I've also become an executive vice president of the university. But in the end, any doctor aspires for is becoming Secretary of Health. And to me, this is the biggest challenge of my life. I do hope that I can do up to task as what the president expects of me. So I've prioritized his action items, but I've also prioritized a game plan that I think in a very short period of 5 years, we will be able to have a healthy Pilipinas, kung saan bawat buhay ay mahalaga, tungo sa bagong Pilipinas.
Well, thank you very much, Health Secretary Teddy Herbosa, for joining us today on Face the Nation. And I would like to congratulate you. You've seen the best and the worst of times today, but I think the best of times will come in for our people in terms of health because of the commitment you have to give them what they deserve in terms of health. So thank you very much for joining us here on Face the Nation.
Thank you very much, Freddie. See you again on Face the Nation.
Face the Nation. Face the Nation.
A pleasant day. This is Freddie Abando. Welcome to our program, Face the Nation. Today, we're privileged to have with us the Secretary of the Department of Labor. We have Bienvenido Laguesma. A pleasant day to you, sir, and welcome to our program, Face the Nation.
A pleasant day, Freddie, and thank you so much for having me in your program, Face the Nation.
Sir, when you talk about the state of the nation, this is going to be a report card of the president when he delivers his SONA before a joint session of Congress. Well, the first 100 days for labor, how would you sum up the programs and projects that you were able to muster in order to build more employment for our people?
I would rather leave the rating to the constituencies, Freddie, because it might be self-serving if I will say we were successful or we were able to do something. But as we have seen from the labor force survey, there is work progression. Employment level has improved. Unemployment has decreased, and we would like to attribute this to the direction of the present administration to open up the economy. And with the help and support of the private sector, there were more employment opportunities created, which actually help our kababayans, the Filipino people, in finding jobs to be able to sustain their daily requirements.
What has been the most significant accomplishments which the Marcos administration was able to gain to ensure that, well, he has to come up with questions regarding the state of labor in the country? Would you say that we're better off or not?
Well, again, I would say, Freddie, that it might be self-serving for me to gauge myself in the Department of Labor and Employment. I would not venture to say that we have improved the lives of our workers, but the fact that we have more employment opportunities generated, cases brought to the department has been acted with dispatch. We're able to help millions of workers be able to more or less avail of the programs of the Department of Labor and Employment, and probably be the basis for saying that we are doing our share, although it's not, it's too early for us to say that everything is actually being put in place. But we continue to strive, to prepare, and to plan so that the Philippine Development Plan 2023-2028 of the President and his administration will really have really accomplished what it has set up for the next 5 years. And we in the Department of Labor and Employment are actually supplementing or complementing the PDP with our own National Labor and Employment Plan, which has been endorsed by the tripartite sectors last June. And hopefully this can be considered and be approved also at the level of the cabinet with the President actually.
Oh, how would you assess the wage hikes that was granted by the regional wage boards that will help our, that will help our farmers?
Yeah.
not
Freddy,
our
Freddy,
workers
sorry, I'm
willing to
sorry, but
cope with the rising cost of life.
Freddy, I'm sorry, but I have to be again repetitious. It's like telling me to rate myself, you know, and that would not be fair to our constituencies and to us. But suffices to say that we continue to do our mandate. Wage increases granted by the wage boards might not be enough or ideal for the workers, but it is a mix, a balance of the needs of the workers and the capacity of employers, considering that majority of our enterprises are in the micro and small, medium enterprises category. So, mahirap na kaming magsabi na magaling kami, Freddy. I hope you will understand. But we are just candid enough to say na we are doing our best and trying to help the administration of President Marcos deliver on what the Filipino people are expecting from the present administration.
Sa tingin mo ba yung rising inflation na nangyari in past months, now it's going down, unti-unti yatang medyo gumaganda na ang kabuhayan ng ating mga kababayan? Well, di ba?
Yes, I think yung pagbaba ng inflation rate at yung ang karagdagang mga hanap buhay na nag-generate ay pagpapatunay na meron namang nakikitang ikangay pag-unlad ang ating bayan at malaking bahagi diyan. Alam mo, ang unang taon ng ating Pangulo, maraming mga pinaharap na problema at malaking bahagi ng unang taon pagbabalangkas ng mga plano, yun lang nabanggit ko na Philippine Development Plan for 2023-2028. So, siguro ang appropriate na time for us to say would be kahit na taon-taon nakikita natin may movement, may improvement, siguro ang talagang pinaka sigurado o mas matibay na batayan kung pagdating ng 2028 makita na yung mga tinarget ng ating Pangulo, inclusive growth, reduction of poverty from to single digit, from the present na double digit, at saka yung pagkaroon ng kalikha ng mga quality at saka decent jobs for our workers. Siguro yun yung panahon na dapat sabihin, did the Marcos administration delivered o nag-fail sa kanyang promise, no? So yan, pero nakafocus ang ating administrasyon doon sa mga balangkas, sa mga plano na ang layunin nga ay magkaroon ng katuparan yung 8-point socio-economic agenda ng Pangulo na inilagay din na kapaloob doon sa ating tinatawag na Philippine Development Plan.
Now, kumusta naman yung naging contribution ng private sector sa current
Malaking bagay, Freddy, malaking bagay ang pribadong sektor kasi ang pribadong sektor siya talaga ang naglalagak ng puhunan, lumilikha ng hanap buhay, nagbibigay ng oportunidad sa ating mga manggagawa at sa kanilang pamilya. Kaya malaking bagay yan, lalo na sa Department of Labor and Employment, yung tinatawag natin na social partners, ang labor and employer sector, malaki po ang kanilang ginagampanan na papel. Ang sa ganun ay makita natin ang pagsulong, pagbangon ng ating bayan at makarating tayo dun sa antas na nasabi nga ng ating NEDA Secretary, meron target na middle level income status ang Pilipinas. No? So hopefully we'll be able to reach that and doon natin masasabi na mayroong mga magagandang bagay na nagawa ang ating pangkasalukuyang administrasyon.
Would you say that foreign investors have a better look at the opportunities that are open to them, given the fact that President Marcos has done a pretty good job in managing the economy to grow and with the ultimate participation not only of of business but at the same time our people in the countryside?
Siyempre, yun ang hinihintay natin na makita yung patuloy na investments ay papasok sa Pilipinas. At yan ang magpapatunay na yung mga biyahe ng ating Pangulo ay matagumpay. At ito ay ating inaabangan dahil as we expect investments to come in, alam mo, pumasok din tayo doon sa RCEP, no? Medyo kailangan ihanda natin ang ating workforce, hindi lamang on account of transformation in the world of work, but also yung mga potential na investors na mangangailangan ng karagdagang mga manggagawa, hindi lamang naman sa mga sentro, no? Kaya nga medyo maingat din natin sa pagbabalangkas ng Department of Labor and Employment doon sa mga programa na makatutulong, may handa ang ating mga manggagawa, doon pa sa mga magagandang hanap buhay na pwedeng malikha ng pribadong sektor.
Would you say that there are better opportunities for our people in the countryside, especially when you talk about agriculture?
Mukhang pag tinignan natin yung labor force survey na nakalipas, maraming nalikhang hanap buhay at trabaho sa agricultural sector, sa fisheries, no? Ito yung nakita natin doon sa huling survey ng ating pong Philippine Statistics Authority. At sana magtuloy-tuloy ito dahil ang magiging resulta, mas mababang presyo ng mga bilihin, yung mga agricultural products na kailangan ng ating mga manggagawa at ng mga ikangaya naglilikha ng hanap buhay, yung mga nagmamanufacture ng mga goods out of the produce ng ating pong mga farmers, ng mga fisher folks, yan ay malaking bagay na makikita natin. At dahilan nga sa karagdagang mga hanap buhay sa ating agricultural sector na sinusupplement o kinokomplement din naman ng ibang mga sektor, industriya, ang turismo, ang construction, siguro masasabi natin na nagkakaroon ng mas malaking pagkakataon ang ating mga manggagawa na makakita ng trabaho na gusto nilang mapasukan dito sa ating bansa.
Foreign investments and tourism, how significant is the contribution of these two to the overall pie of the economy?
Napakalaki, Freddy, kasi yun nga, bumabangon ng ating ekonomiya at medyo yung ating pong, bukod dun sa agrikultura, yung food and accommodation services na related sa turismo, malaki din ang dagdag ng mga hanap buhay. Kaya masasabi natin na kung lalong gaganda ang ating pong tourism industry at lalong makakaakit ng mga turista, hindi lamang internationally, even domestically, siguro ang pagbabahagi ng mga pakinabang o biyaya matatamasa rin o mararamdaman sa mga lugar na hindi naman na urban centers, no? Kasi marami sa ating mga lugar na pinapasyalan ng mga turista ay yung mga nasa lugar ng Visayas, Mindanao, although meron din naman sa Luzon.
A final word from you, Secretary. Sa tingin mo ba, whatever has been started, which is good news for the country despite certain concerns from several sectors, nakikita mo ba yung cooperation na dapat ibigay ng opposition at this time? Because we're facing a global crisis. The president has been good in managing it, but everybody should be participating in a national concern which involves the entire country and not just the Marcos administration.
Alam mo, Freddy, bawat Pilipino na nagmamahal sa bayan sa ating bansang Pilipinas, siguro dapat na makiisa dahil ang layunin naman ng ating pangkasalukuyang administrasyon, iangat ang kalagayan ng ating mga mamamayan at makapagdulot ng ginhawa sa bawat Pilipino. Pag titignan mo ang mga programa ng ating pong administrasyon saka ngayon, may mga kinalaman doon sa mga basic na requirements ng ating pong mga mamamayan. Pabahay, abot kayang presyo ng mga bilihin, makapalikha ng karagdagang hanap buhay sa pamamagitan ng ating pong pribadong sektor. Lahat po ito, pag pinagsama-sama mo, Freddy, ay mga ngahulugan na talagang magkakaroon ng pag-unlad ang ating bansa. Kaya dapat makiisa sana ang lahat at may panahon naman kung saan kailangan pumasok yung politika. Dahil ang politika naman ay hindi masamang bagay, kailangan lamang siguro na sa tamang panahon at kung sa panahon na kailangan tayo magkaisa at magtulong-tulungan, dapat siguro yun ang mga pangunahin na maging hangarin o pupuntahan ng bawat Pilipino dahil lahat naman tayo ay nagnanais, no? Whether you are in the administration, in the opposition, o kaya naman ay in between administration and the opposition, lahat po tayo ang layunin natin ay paunlarin ng ating bansa. No? Wala namang sigurong exclusion. No? Maaring magkakaiba lamang ang pamamaraan, subalit ang bottom line niyan, lahat tayo nagmamahal sa ating sariling bayan.
Final word from you, Secretary.
Maraming salamat, Freddy, sa pagkakataon at hopefully sa tulong din ninyo ng inyong pong programa, mapaabot din sa ating mga kababayan ang patuloy na pagsisikap at pumpunyagi ng ating pong pangkasalukuyang administrasyon sa pangunguna ni Presidente Ferdinand Romualdez Marcos Jr. na pagandahin at pangatin ang kalagayan ng bawat mamamayang Pilipino kasama ang kanyang pamilya.
Well, thank you very much, Labor Secretary Benny Lacuesta, for joining us today here on Face the Nation. God bless.
Face the Nation.